Movement is probably the most important thing that we need to concentrate on as we recover as we start to recover out of chronic pain. And the reason for that is when we're in chronic pain, what we all seek to do is actually be out of pain. And generally the way that we try to be out of pain is to find a position or find a couple of positions that are generally pain-free. The problem with that is that as we get more and more pain, as our chronic pain increases, our movement profile decreases until there's only a few places that we can actually settle ourselves that actually means that we are in fact pain-free. Now the problem with that is that if we only settle in the areas that are pain-free, all of the other movement possibilities are denied to us because they're painful. Now the reason why they're painful is because our brain perceives threat in the movement. There may actually be no problem with the movement, but it's just because you haven't done it over a period of time that your brain is like, are you sure? That might be that might be threatening, and you will generally experience pain, tightening of the muscles when you try to move in a particular area. In neurology, we have a phrase that we often say to our patients, and this is, movement is inversely proportional to pain. And if we unpack what that means, it means that if you're sending lots of clear, beautiful information up from your body saying, okay, I can move in this way, and I can move in this way, I can rotate, I can look up, the brain will analyze that and go, okay, well, if you can do that, we clearly don't have a problem in that area, and we're going to give you less pain. So as we start to progress through our pain journey out of pain, we'll be encouraging you to do lots more movement in the clinic, because what we need to do is rage against the implosion of our movement profile and really push back on it. So what we might find is we might get you completely out of pain in clinic, but there will be certain movements that are still painful. And so what we need to do in a very safe and structured way is we need to encourage you, in fact, to move into the areas that are painful in order that we can re-educate the nervous system that there's actually no threat there, and then eventually those movements will become pain-free.